Hi there, it's Cherylea from Anatomy for the People. In this video, I'm going to be talking about the blood supply to the organs of the abdominal cavity and their drainage. So let's start with the abdominal aorta. So we know that the abdominal aorta is a continuation of the thoracic aorta, which has come directly from the heart. So we have two small branches coming off the abdominal aorta as soon as it passes through the diaphragm. And these are the left and right inferior phrenic arteries. So the inferior phrenic arteries are going to be supplying the diaphragm inferiorly. You will also get small esophageal branches that come off these arteries, which will follow the esophagus as it moves through the diaphragm. Okay, so the first major branch coming off the abdominal aorta is the celiac trunk. And the celiac trunk has three main branches, and they will be your common hepatic artery, your splenic artery, and also the left gastric artery. Okay, so now let's follow the splenic artery. So the splenic artery is really twisted and curly like this as it runs behind the pancreas. So it is going to give off branches that go into the spleen, which gives it its name. So these are your splenic branches. I'll just put SB. And you will also have some branches coming off here, which are your short gastric arteries. So these are your short gastric arteries and they go up to supply the fundus of the stomach. You will also have coming off the splenic, I'm just going to pop it here behind the word, is going to be your posterior gastric artery. Coming off here and wrapping around the greater curvature of the stomach is our left gastroomental artery or our left gastroepiploic. Let's go with left gastroomental. So coming off the left gastroomental, as I said, is going to be following the greater curvature of the stomach. It's going to give off small gastric branches which run up to the stomach. And it's also going to give branches which go through the greater omentum. So they would be your omental branches. Okay, so the left gastroomental artery is going to anastomose with the right gastroomental artery, but that actually comes off some branches that have come from the common hepatic artery. Okay, so let's have a look at the left gastric artery now. So the left gastric artery is actually going to run in the lesser curvature of the stomach, obviously supplying the stomach, so you have little gastric branches coming off here. Also coming off the left gastric artery, you have some esophageal branches, which also run up the esophagus as it's passing through the diaphragm. Okay, so let's now follow the common hepatic artery. So hepatic means liver, and this is the main artery that is going towards the liver. So we have the common hepatic artery going over to the right-hand side of the body, and it gives off a branch running downward, which is the gastroduodenal artery. And the gastroduodenal artery has four major branches, 1, 2, 3, and 4. And we'll start with this one over here. And so this is going to be our right gastroomental artery. So this one here is going to anastomose with that left gastroomental artery, as I mentioned before. Here we have the superior pancreaticoduodenal. We also have the retroduodenal artery. Retro means behind, so this is going to go behind the duodenum. So the retroduodenal, and then we also have the supraduodenal. Okay, so they're the main branches coming off the gastroduodenal artery, and let's continue back onto what the common hepatic artery turns into after the gastroduodenal branches off. So the common hepatic artery then turns into the proper hepatic artery. So proper hepatic artery. So coming off the proper hepatic artery, we have the right gastric artery. So that comes down like this, and right gastric artery, and that is going to then anastomose with the left gastric artery. Okay, So continuing on as proper hepatic artery, it's then going to get towards the liver. And when it gets into the liver, it's going to branch off into the left hepatic artery and the right hepatic artery. And so the hepatic arteries are bringing oxygenated blood to the liver. We are going to have nutrient-rich blood also being pumped into the liver, coming from the gut, but that is going to be coming from a vein called the portal vein. Okay, so branching off the right hepatic artery, we have a small artery, which is the cystic artery, and the cystic artery is going towards the gallbladder. Okay, so now let's move on to the next major branch coming off the abdominal aorta, and that is your superior mesenteric artery. So the superior mesenteric artery has three main branches, and these are the middle colic, right colic, and the ileocolic. So the mid-colic artery is going to run upwards and then supply half of the transverse colon, so the right-hand side. This is going to sometimes include the hepatic flexure of the large intestine. The right colic artery is going to supply the ascending colon. The ileocolic is going to supply the cecum, surrounding structures, and the majority of the small intestine. So the ileocolic is going to give off a lot of little branches, which are your jejunal and your ileal branches. So I'll say jejunal, J and I. You will also have a branch coming off the ileocolic, which is the appendicular, going towards the appendix. I'll just put AP. Okay, so before I move on from the superior mesenteric artery, there is a small branch that comes off this artery before it gives off those three main branches. And I'll do it right here, and that's going to be the inferior pancreatico-duodenal. So it's going to match up with this one. So I'll just put inf here, and then we've got the same name all squished up in there. Hopefully that's not too confusing for you. Okay, so now let's move on to the renal arteries. So the renal arteries, I can't fit that here, but it's going to be behind here. So I'll just pop that there. So this one is going to be our left renal artery, and obviously on this side we'll have our right renal artery. So the renal arteries are feeding blood to the kidneys. It is pushing oxygenated blood to supply the tissue, but it's also putting blood in the kidney so it can get filtered, so it can remove metabolic wastes and then therefore produce urine. So I won't go into that in too much detail. I'll probably make a different video on the blood supply to the kidneys themselves. So coming off the renal arteries on both sides, you will have, let's just extend this a little bit more, you will have a small branch coming off the top. So remember, all of this blood is feeding into the kidneys. You will have a small branch coming off the renal artery itself, and that would be the inferior suprarenal. And so the suprarenal gland, or the adrenal glands, are these small little glands that sit on top of your kidneys. So this is the inferior suprarenal, and since we have an inferior, we're actually going to have a superior suprarenal and also a middle suprarenal, and they come directly off the abdominal aorta. So that would be your superior suprarenal, and this would be your middle suprarenal. So just remember that they're connected to that name there. Okay, so below the renal arteries, we're going to have two branches coming off, directly off the abdominal aorta, and these are your gonadal arteries. So this would be your left gonadal artery, and over here would be your right gonadal artery. So the gonads of males are obviously the testes. So in males, the gonadal arteries will be your testicular arteries, and in females, it will be the ovarian arteries. Okay, so below that, we are going to have another large artery coming off the abdominal aorta, and this is your inferior mesenteric artery. And the inferior mesenteric artery has three main branches, and these are the marginal artery, the left colic, and the sigmoid arteries. The sigmoid artery is going to also give rise to the superior rectal artery and also the superior sigmoid arteries. Okay, so the marginal artery will supply the left-hand side of the transverse colon, including sometimes the splenic flexure. The left colic artery will supply the descending colon, and the sigmoid artery will supply the sigmoid colon. And as you can see from these branches, will supply parts of the rectum as well. So these are the main branches. You do have a small branch that is going to come off here in the middle, and this is our median sacral artery, also known as the middle sacral artery. And the median sacral artery will supply parts of the rectum, but it will generally supply the bones within the pelvic region. So vertebra L5 down to the sacrum. So there are as well some lumbar branches that come off the abdominal aorta directly, but just including them is just a little bit busy. But you should have three main lumbar arteries. So you will have lumbar arteries 1, 2, and 3, which will supply the corresponding vertebrae in the area, and then the median sacral will pick up kind of the rest on its way down. Okay, so we can see that the abdominal aorta is going to bifurcate, giving off the left common iliac and the right common iliac arteries, and this will go on to serve pelvic structures and also the entire lower limb. Okay, so let's move on now to the veins. Okay, so now let's have a look at the veins that are going to drain directly into the inferior vena cava in the abdomen. So if we start from the bottom, we're obviously going to have the left common iliac vein and the right common iliac vein joining together to form the inferior vena cava. So here we have our left common iliac vein and our right common iliac vein. Okay, so running into the left common iliac vein or directly into the inferior vena cava, we have that median sacral vein. So I'll just do it here, and then that can be our median sacral vein, also known as middle sacral vein. Okay, so at the end of this section, you will come to realize that there are not too many things that drain directly into the inferior vena cava. It is what is draining into the portal vein, which has a lot more complexity, but I will cover that as well. Okay, so draining directly into the inferior vena cava, we also have lumbar veins draining in, just like we had in the arterial system when we had the lumbar arteries coming directly off of the abdominal aorta. So just these ones here, I won't write it down. These are our lumbar veins going directly into the inferior vena cava. So also coming in, we're going to have the right gonadal vein. And the right gonadal vein, so that would be the right testicular vein in males, and then the right ovarian vein in females. So this drains directly into the inferior vena cava, whereas the left is going to drain directly into the left renal vein. So let's just pop them around this level here. Okay, so this is our right renal vein, and this is our left renal vein. So draining into left renal vein, you have your left gonadal vein. Then we have the suprarenal vein. So we have the left and right suprarenal vein, so that can drain directly into the inferior vena cava or run into the renal veins. So it really just depends on what's closest, and this is obviously really varied in different people. So how about we just do it running into the renal vein? So we've got our left suprarenal vein. And we can pop this one on the right going directly into the inferior vena cava. So now as we move up towards the diaphragm, we're going to have the openings for the hepatic veins. So the hepatic veins are draining the liver. So this is the blood that has moved through the liver. It has had the oxygen taken out of it, or some of the oxygen taken out of it, and a lot of the nutrients that have been picked up from the gut. So this blood is now deoxygenated and nutrient poor. So these are our hepatic veins. We have three main ones. 1, 2, and 3. And so we have our left, our middle, and our right hepatic veins. So in this region, we also have the inferior phrenic veins coming in. So this can be above the hepatic or a little bit below, but for space, let's just pop them below. So draining in here, we have our right inferior phrenic vein and our left inferior phrenic vein. Okay, so this is what is directly draining into the inferior vena cava. And as I mentioned before, it gets more complex when you talk about what drains into the portal vein, which goes into the liver, then eventually drains into hepatic veins to get back into the inferior vena cava. So in the next part of this video, I'm going to be talking about the tributaries of the portal vein. So the portal vein is going to be draining the majority of the blood from the abdomen. It is going to take blood from the superior mesenteric vein, inferior mesenteric vein, and the splenic vein. So it is going to take that blood and it is going to move it into the liver. And once the liver is done with it, it is then going to drain out via the hepatic veins, which I mentioned in the previous section of this video. So let's just draw a quick schematic diagram of these main tributaries, and then we're going to look at all of the different branches that will drain into those. Okay, so this is our basic structure. It's a little bit wonky, but you know what I mean. Okay, portal vein. Up the top, we have the superior mesenteric vein, the inferior mesenteric vein, and the splenic vein. Okay, so running into the superior mesenteric vein, we have three main veins. 1, 2, and 3. So same names as the arteries that came off the superior mesenteric artery, so that's easy. We have our middle colic, we have our right colic, and our ileocolic. Mid-colic is going to be draining the right-hand side of our transverse colon, including the hepatic flexure. Right colic is going to be supplying the ascending colon. Ileocolic is going to be doing cecum, structures around there, and majority of the small intestine. So running into ileocolic, we have the appendicular, so coming from the appendix. And then running directly into your ileocolic, you have lots of jejunal and ileal veins. Also running into the superior mesenteric vein, you have on this side here, running in, this will be your right gastroomental vein. And so this is going to be anastomosing with the left gastroomental vein, and that's going to be running on the greater curvature of the stomach. Also draining into the superior mesenteric vein, you're going to have, your pancreatico-duodenal branches as well. Superior and inferior pancreatico-duodenal veins. Okay, so moving on to the inferior mesenteric vein. So we have three main veins draining into it. So 1, 2, and 3. We don't have a marginal vein like we had a marginal artery coming off the inferior mesenteric artery, but we do have the left colic vein, and that is going to be doing the descending colon, and then we have our sigmoid vein or veins, and then this is going to include sigmoid rectal veins, and then you have your superior rectal vein. Okay, so nothing else exciting is draining into the inferior mesenteric vein. So let's now move up to the splenic vein. So we can see the inferior mesenteric vein drains up into the splenic vein. So we have the splenic branches, because we know the spleen is right here. Draining up around where the splenic branches are coming in, we're going to have our left gastroomental vein, and that's going to anastomose there on that greater curvature of the stomach. So here we have our splenic veins, or the splenic branches running into the splenic vein. We have the short gastric vein draining in here, short gastric. You also have pancreatic branches draining directly into the splenic vein. So keep in mind the splenic vein runs behind the pancreas, posterior to the pancreas. You'll also have the middle gastric vein running in here. So we didn't have a middle gastric artery, we had a posterior gastric artery. So that's the middle gastric vein. You have the left gastric vein draining in. You have the right gastric vein going directly into the portal vein. Okay, so the portal vein is going to then branch out, lots of branches, and end up in the liver. Okay, so we've picked up all of this nutrient-rich blood from the gut and deoxygenated blood from the structures of the abdomen, and we've brought them up to the liver. So then the liver will then, take those nutrients, store them for later usage, and then, as I mentioned before, once it leaves the liver, it enters into the hepatic vein, so it can go into the inferior vena cava. And just one more to add, draining into one of these kind of portal branches, you will have your cystic vein, and that's going to be draining the blood of the gallbladder. Okay, that's it. Thanks for joining me today. I hope that you've learned something. See you next time. Bye.